How long should I wait for a continuing healthcare funding decision?
The national framework for continuing healthcare funding specifically states that from the date a referral for assessment is made to the clinical commissioning group with responsibility for undertaking continuing healthcare funding assessments in that area, they have a maximum of 28 days in total from receiving that referral to completing both assessments, both the continuing healthcare funding checklist assessment and where it triggers a full decision support tool assessment, to the outcome being received, which I can categorically state is in reality grossly underscored and underplayed in terms of the time that is actually required to do those things. The reality, unfortunately, can be that it can take many weeks, sometimes months, from the date of even requesting an assessment for continuing healthcare funding to be undertaken for the first stage checklist assessment to be completed. The problem with this, of course, is that whilst we sympathise with the NHS in terms of the budgetary constraints and the issues that we know that they have, and of course the ability to be able to undertake these assessments and comply with the processes, that doesn't change the fact that the national framework created by the Department of Health clearly states that this should be conducted in a swift and timely manner. Now, the reason they have stated it should be conducted in a swift time frame is, of course, because in theory during this assessment process an individual can be in care incurring astronomical costs, often exceeding £1,000 a week, at their own expense. So clearly any delay in the implementation of an assessment for an individual who is ultimately entitled to the funding has a direct result in a cost implication to them. A more cynical individual may say that where there are delays, it's a benefit to the NHS because they are therefore not then incurring those costs in a swifter time frame than they might otherwise have been. We will not know, and we will never know if that's a deliberate act on the part of some NHS trusts. We suspect it's more to do with budgetary constraints, but of course when processes are not being complied with and no reasonable explanation is given as to why that's the case, individuals become understandably frustrated, and of course questions then start to be asked as to why people are not doing what they should when they should. Now, this is a clear justification and reason for one of the issues as to why it can be necessary to instruct an expert individual or company such as Compass Continuing Healthcare to assist you with this process. We know the national framework, the rules by which continuing healthcare funding are governed inside out. We are experts in this area and we are able to divert resources to chasing and chivying and ensuring that NHS assessors and CCG continuing healthcare funding teams do what they should when they should be doing it. A family faced with this scenario or having to deal with the fact that they already have a very unwell relative who requires care and clearly has very complex health needs that have warranted even considering asking for such an assessment to be undertaken. The last thing they reasonably need to be dealing with is having to chase continuing healthcare funding teams for assessment dates. All of this, of course, on top of that, they may well have jobs themselves and professions and children and simply be unable to divert the time that's required. Because we are experts in this area, we know the rules of what should be happening, when it should be happening, and we're able to act on your behalf and the patient's behalf, ensuring that things are done when they should be done in an effort to minimise delays and ensure a successful outcome in the swiftest possible time frame. That's what we're seeking to achieve. With that in mind, if you do have any issues with continuing healthcare funding, be it just a general discussion that's required in the first instance about how it all works, we have a team of experts that are available to talk directly on our phone number, which is 0121 227 8940. Equally, our website is a useful resource for information and can be found at www.continuing-healthcare.co.uk. We'd be more than happy to have a confidential, no obligation and free discussion with you and to be able to assess what the particular circumstances of your case are and what options you have available. Thank you.